This Black History Month, we continue to focus on issues within the Black community, looking at how far we've come and how far we still have to go.
There are many areas of health care for people of color that need improvement. In fact, research has found lack of quality care contributes to less favorable outcomes with several conditions, one of which is congenital heart defects in Black babies.
Morning anchor and health reporter Kirsten O'Connor is standing by now to ask a doctor more on why this happens and what can be done to help solve the problem.
Ask a Doctor is sponsored by Conviva Primary Care for Seniors.
Well, congenital heart defects, or CHDs, are the most common birth defects in the U.S., with an estimated 2.4 million Americans living with diagnosed conditions. However, research shows that social determinants like where you live, work, or play can not only limit a baby being diagnosed, but also an adult receiving lifelong quality care. So I spoke with Dr. Keila N. Lopez, an associate professor of pediatrics, Division of Pediatric Cardiology at Texas Children's Hospital and Baylor College of Medicine, about this problem.
I was able to participate in a research study specifically looking at health disparities throughout the lifespan, starting from 1999 to 2017. And what we found that was from prenatal diagnosis all the way until at least the age of 35, that there remains health disparities, particularly for Black infants versus white infants throughout the lifespan, such that the Black infant mortality was at least 10% higher than that for white infants. What are the hospitals that are nearby, areas where there are larger percentages of lower income individuals or individuals that live in areas that have less access to heart disease centers? And so depending on where you live and what your access is to these really experienced heart centers, that can, of course, impact your ultimate outcome. And so because of longstanding structural racism, a lot of the heart centers that individuals can have access to are far away from the areas that have predominant Latino and African Americans living there.
And Dr. Lopez says this is true of all health conditions, but especially when it comes to CHDs. The important thing, she says, is to do the research and advocate for yourself and the care you deserve, no matter who you are or where you come from.
The self-advocacy really has to do with getting informed, becoming informed that CHD is a lifelong lesion, and understanding where the optimal care can be accessed throughout the lifespan. Doing the research on which heart centers are best equipped to take care of children with congenital heart lesions, as well as having a center that is specialized in prenatal diagnoses of congenital heart disease. Those two things alone can really change outcomes in terms of how a patient does from the outset. What we are advocating for patients is not only that the patients are able to access quality care and have access to these heart centers, but also that the providers who are taking care of them do social determinants of health screening so that we can optimize outcomes for these patients, as well as having training for the providers, implicit bias training, so that you kind of check your own biases in terms of the patients that you're caring for, as well as other types of training that help us to best care for individuals from all sociodemographic lines as well.
And the reason great prenatal care is so important is if your baby does have a condition like a CHD, the earlier the intervention, the better the chances for survival and living a normal life. But Dr. Lopez says if your baby is diagnosed with a CHD while you're pregnant, you should not panic. Having a CHD is not a death sentence.
There are many, many individuals born with congenital heart disease lesions that live long, prosperous lives. It is not, as you stated, a death sentence. And one example that I have to give because of the Olympics, Shaun White is an adult congenital heart disease survivor. He has tetralogy of Fallot. It's one of our moderately severe lesions. He has won gold medals. He has lived a very prosperous life, I'd say, thus far. And so he's a very good example of how prosperous someone can be and what quality of life someone can live if they have the appropriate care and access.
Dr. Lopez continued to say that the American Heart Association is now working on more research to determine why people get congenital heart diseases, as well as how to improve those outcomes for anyone who has them. Again, as always, if you have any concerns, not all heart defects are diagnosed in children. So it is possible to be diagnosed later in life. If you ever find yourself short of breath often, or if you're fatigued or experiencing any other kind of strange discomfort, reach out to your doctor just as soon as you can.